Principle of enzyme immunoassay. The general principle of this technique is based on the binding of conjugated enzyme molecule with specific antibodies to detect and quantify the presence of either antigens or antibodies in the test sample. This is followed by adding appropriate colorless substrate, which catalyzes the interaction complex to produce a visible color product. There are many chromogenic substrates used in ELISA technique, but the most common are alkaline phosphatase and horseradish peroxidase. The end product can be determined by using spectrophotometer, and the intensity of color is directly proportional to the presence of either antigens or antibodies in the test samples.
EIAs, which use enzyme as labels, are one of the most common forms of immunoassays. ALP, HRP, glucose-6-dehydrogenase, and beta-galactosidase are the most common enzyme labels. Colorimetric assays, which are monitored visually or photometrically, fluorogenic assays, and the more sensitive chemiluminescence assays have all been utilized to detect enzyme labels. Since of their catalytic capabilities, enzymes can be used as labels because they can detect and quantify extremely minute amount of immune reactants. Standard enzyme labeled immunoassays, which are ELISAs, are the preferred method for the detection of mumps virus such as IgM and IgG antibody due to its efficiency and simplicity. There are pros of using enzyme labels. For example, the amplification action of the enzyme can cause sensitive assays. Second, reagents are generally inexpensive and have a lengthy shelf life. As a result, a range of enzymes can be employed as labels. The cons of enzyme labels are enzyme activity can be more difficult to quantify than the activity of some type of radioisotopes. Also, plasma component can impact enzyme activity. At the moment, homogeneous assays are relatively insensitive and they are only useful for measuring haptens.
Classification. Enzyme immunoassays are classified as either heterogeneous or homogeneous on separation criteria of immunocomplex. For homogeneous immunoassays, no separation step is necessary because enzyme activity diminishes when binding of antibody and antigen occurs. Homogeneous assays are also generally less sensitive than heterogeneous assays, but they are rapid, simple to perform and adapt easily to automation. Their main use has been in the detection of low molecular weight analytes in serum and urine, such as hormone, therapeutic drugs, and illicit substances. The SIVA Corporation have developed enzyme multiplied immunoassay technique, or also known as MIC, as an example of homogeneous assay. Homogeneous assays are based on the principle of change in enzyme activity. A specific antigen-antibody combination occurs. For the general procedure of homogeneous immunoassays, first, reagent antigen is labeled with an enzyme tag. Second, when antibody binds to specific determination sites on antigen, the active site on the enzyme is blocked, resulting in a measurable loss of activity. Third, free analyte antigen competes with enzyme-labeled analyte for a limited number of antibody binding sites, so this is a competitive assay. Lastly, enzyme activity is directly in proportion to the concentration of patient antigen or hapten present in the test solution. Heterogeneous enzyme immunoassays, on the other hand, require a step to physically separate free from bound analyte. There are two kinds: competitive and non-competitive ELISA. The competitive ELISA relies on the competition between antigen of interest and reference antigen towards the limited amount of antibodies. Therefore, competitive ELISA is also named as inhibition ELISA. On the other hand, non-competitive ELISA does not rely on the competition between target antigens and reference antigen. It uses an excess of label-specific antibody toward the analyte of interest. Thus, this is the key difference between competitive and non-competitive ELISA. Direct ELISA, indirect ELISA, and sandwich ELISA are the three main types of non-competitive ELISA. For the general ELISA procedure, first, when antigen is bound to solid phase, patient serum with unknown antibody is added and given time to react. After a wash step, an enzyme-labeled antiglobulin is added. The second antibody reacts with any patient in antibody is bound to solid phase. If no patient antibody is bound to the solid phase, the second labeled antibody will not be bound. After a second wash step, the enzyme substrate is added. The amount of enzyme label detected is directly proportional to the amount of antibody in the specimen.
Few tests use different types of enzyme immunoassays known as ELISA. First test is a pregnancy test. A pregnancy test uses sandwich ELISA to determine HCG or human chorionic gonadotropin in urine or serum. Two monoclonal antibodies are used to detect HCG with great sensitivity. Elevated HCG levels as low as 20 milli-international unit per milliliter can be noticed in less than 10 minutes, meaning that the person is pregnant. Second, sandwich ELISA can also be used to measure and detect cytokine. Cytokine sandwich ELISAs are sensitive enzyme immunoassays that can detect and quantify the quantity of soluble cytokine and chemokine proteins. In its simplest form, a captured antibody on a solid support, typically one well of a 96 plate, extracts cytokine from a biological fluid such as serum. A secondary antibody to a distinct epitope on the cytokine is then added to form an antibody-antigen antibody sandwich. Finally, indirect ELISA can be used to detect HIV infection. For example, the non-antigen HIV peptides is attached to a well in a 96 well plate and the analysis begins. If the patient has HIV, anti-HIV antibodies attached to the antigen and are recognized by the second antibody enzyme conjugate.